Hi, welcome to the training, the basics of an EOB. My name is Elizabeth Woodcock, and I appreciate your being here with me today to learn more about this topic. Before we get started, what is an EOB? Another acronym in healthcare. Allow me to mention that it is the explanation of benefits. That's what the acronym stands for. But actually, sometimes it's referred to as an EOP, which is an explanation of payments. And you'll certainly learn why. We also know that it is commonly called a remittance or sometimes even a remit for short. And the reason we refer to it that way is that that's the actual documentation that the material comes on. So, what are we talking about here? An EOB or an EOP or a remit is the documentation submitted to the medical practice, to your business office, that provides a record of what the insurance company is paying or has decided not to pay. And for the latter, we typically call that a denial. It is commonly transmitted electronically, but may still be received on paper. The ones we're going to go over today are actually often screenshots of those that were received electronically, but I'm displaying them to you on paper. Why might you need to know this? Whether you're a biller or maybe a coder, quite often you'll get involved into payment issues. If everything goes right and you're paid correctly, maybe you won't ever actually have to look at this EOB. But as you and I both know, indeed, even if you've had one day in a billing office, things don't always go as planned. And so, indeed, I suspect you'll run into this pretty quickly if you work in a billing office. So, as I mentioned, my name is Elizabeth Woodcock. I run a consulting firm called Woodcock and Associates, and I've been really lucky to be working in and around professional fee billing for about 30 years. I started off at the University of Virginia, their billing office called the Health Services Foundation, where I really was able to learn a lot about billing. And so, what I want to do is impart some of that knowledge to you so that you can have these foundations as you either start your billing journey or continue it. Now, speaking of foundations, let's go back to some really important essentials about payments for professional fee services. And by that, I mean doctor's offices, the professional side of hospital outpatient clinics, what we define as CPT codes. And I'm contrasting that to working in a facility, a hospital, a skilled nursing facility, a assisted living facility, et cetera, where you may be using DRGs, diagnosis related groups. So, our focus for our training session is looking at EOBs, looking at EOPs remits that are coming in for professional services. And so, indeed, the way we think about pricing is we have a charge. It is, just like you would go into the grocery store. It's whatever the price is for the item. And for us on the professional services side, we attach that price to a CPT code. Now, again, sometimes, and I'm sorry to do this to you, but sometimes it's called a line item. So we would either call it a CPT code or a line item, and there's a charge or a fee associated with that CPT code. Now, indeed, the charge is typically the main driver of the price, but there's some other factors like a modifier or the place of service where it's being performed, et cetera, that also may influence reimbursement. We don't need to get too deep into the weeds. We just need to know there's this price. Now, unlike the grocery store where, you have a, gallon of milk and you take it to the register and it costs, the price tag says $3.53. In healthcare and professional fee services, we don't actually pay typically the price that is listed on our claim. We have what is called an allowance. And an allowance is that which is the price that is established by the insurance company that is allowed for the physician to collect for that service. That's why we call it an allowance. You can see the root word allow. And so that is the price, again, doesn't matter how much you charge, that is the price that United Healthcare, that Medicare, that Medicaid, that's all we are allowed to get for that service for that insurance company's beneficiaries. And then you might say, well, whoa, why is there a third column here? That doesn't make any sense. And you're right. Typically, the payment equals the allowance, but sometimes it doesn't. When wouldn't it? Well, it may be, for example, that the allowance includes the patient's $50 copayment that they're supposed to pay at the point of service. And so if they never pay that, maybe you didn't collect it, or for whatever reason, the patient didn't pay it, then unfortunately, the payment is going to be a lot lower than what we expected or what we were allowed to collect. So the difference between the charge and the allowance is called a contractual adjustment. And the difference between the allowance and the payment is called bad debt. So wanted to point that kind of high level overview about our pricing structures. Again, we can go really deep into the weeds, but this is a good overview. So let's take a look at an example. I'm going to look at 99212, which is a CPT code for a level 2 office visit that lasts 10 to 19 minutes for an established patient. 99212 can be used by any type of physician, family medicine, neurology, endocrinology, surgery, etc. Again, when it defines a level 2 office visit that is 10 to 19 minutes for an established patient, the practice may charge $150. Honestly, doesn't really, I don't want to say it's arbitrary, but it's fairly arbitrary in terms of the practice is able to set its own charges. Remember, sometimes that's called a fee. And then indeed, for this patient, let's say it's a Medicare beneficiary, a Medicare patient, we're only allowed to collect $57.45. That's it. That's all we can collect for that patient. And we know that because that is the 2022 Medicare national payment amount for physician offices, which are considered non-facilities. And so what that means is $92.55, goodbye, it's gone. It's a contractual adjustment. We never collect it. And then remember, Medicare doesn't always pay that allowance straight up. They may have a co-payment or a co-insurance, and then maybe they would pay the residual directly from Medicare of that $7.45. That's a good example. So let's go ahead and take a look now at an actual explanation of payments. And I want to do a kind of very, very straight one so that we can really be able to see what is going on. So speaking of Medicare, this actually is a Medicare. This is a Medicare explanation of benefits, and this is for a spine surgery claim. And you can see, interestingly enough, that we actually have a number of line items here. This is a single patient, but the surgeon is performing, as you can see, 7 different line items or CPT codes. Here are our CPT codes. We call those procedure codes. And that's the first thing that you will likely be able to really quickly see on an EOB. And indeed, we've got the date of service. This is October 29th, 2021. And you can see this insurance company is calling it quote unquote service date. Sometimes you'll see that written as date of service. So we know we have the procedure code. That may also be listed as CPT because that's exactly what it is. And then for this insurance company, they've listed really nicely the modifiers that were submitted on the claim. And you can see those 62 and 51, 51 and XU. And you can see here the units charged. Now, typically the units charged are one, but sometimes they're not, right? If I have an injection, for example, and I give 3 different units of that injection, I might have a 3 here. So those are pretty kind of, just an outline of what's going on with this explanation of payment. Now, let me go back up to the top and just mention here are some of the details. And oh, you can see here, right? This one's called a remittance. So we don't always see it called an EOB or an EOP. Sometimes, indeed, it is a remittance because it is meant to describe the payment that the insurance company is making. So typically, as a biller, you will also see your provider's name, the NPI, which is the National Provider Identification Number. And that is actually, you can just Google it right now. You can take your doctor's name and just go NPI for Dr. John Smith in Indianapolis, and you would be able to find the NPI. So that's a publicly available data point. His, her, their address would be here. And then you can see here's actually our payer. And interestingly enough, I can quickly see that this is a Medicare, and that is a Medicare carrier. And we are in a physician office, so it is a Part B claim. I can see that the electronic funds transfer was sent on November 29th, 2021. And here's our EFT number. And this is something that may actually end up being important because if there's a challenge with this payment, you may actually have to go look and see, did our bank ever get this money? Because it is being sent via electronic funds transfer. Now, let's move further down the remittance. And you said, oh, well, gosh, Elizabeth, I thought you told me this was Medicare. Well, it is, but as you can see, it's been crossed over to a Medicare secondary payer, and that is Mutual of Omaha Insurance. Again, that's Mutual of Omaha Insurance. And Mutual of Omaha Insurance is likely going to be the patient's Medigap policy, and it will be sent the claim for any sort of patient responsibility. So that might be a co-insurance, for example, or a co-payment, for example. So again, we've got the primary is Medicare. In this case, it's WPS, which is one of the Medicare carriers in the Midwest, and it is being crossed over to the Medicare secondary. Now, interestingly enough, this happens in the background automatically by Medicare. So you don't, as a biller, even need to worry about sending it over to the Mutual of Omaha Insurance Company. It's actually been done automatically. Again, this is meant to be a documentation of what's going on, but it's important for you as a biller and a coder to really be able to see what that is. So let's take a look, right? We've got here one of our surgical codes, and we don't even have to know what that code is to kind of be able to start unpacking it. This is what we charge for it, about $4,800 here. Oh boy, we certainly weren't going to get that $4,862 because our allowed amount, remember, that's the money we are allowed to collect, is $1,456.65. Now, what we can see is that, let's just go over here and read this service line paid amount. This is actually what was paid associated with this remittance, and it's only $1,185.18. So what happened? What's the difference between the allowed and the payment? Well, let's back it up and see. Okay, The patient didn't get anything to their deductible, but they did get some of the money applied to their coinsurance. So this $291.33, that got applied to the patient's coinsurance. And indeed, we know that this claim was crossed over to Mutual of Omaha to the Medigap policy. So the patient will get that coinsurance amount, but they'll pass it off to, or they'll have it passed off to that Medigap policy. So we also have indeed, a remark code. Let's look at what that is. N807. Oh boy, a remark code N807. Now, fortunately for us, this remittance actually has it on it. And you can see this is a payment adjustment based on the merit-based incentive payment system. So what this means is, this particular practice did not perform successfully in the government's quality payment program. And so they're actually getting dinged. They're getting a negative payment adjustment. You can see here $20.85 on this line item. As it gives us further explanation, this 144, we can loop right here and it sees, incentive adjustment. So that's why the payment in this case is not equal to the allowable, because we have a coinsurance that's being sent off to the Mutual of Omaha, and we have a penalty that is being applied. And you can see it's being applied to all of these areas. And the only exception that I did want to point out is there is one other code here, 5959. This is very common for surgical practice. And again, really nicely, we can see here that the remittance displays right there, process based on multiple or concurrent procedure rules. So these are areas, though, that you want as a biller to look out for, because we want to start asking ourselves, okay, before we just assume that all of these adjustments are correct. Is it correct? Did we fail to comply successfully with the merit-based incentive payment system? Is this really a multiple or concurrent procedure rule? That's something that's probably deeper than what we can get into during our session today. But I did want to give you a clue that not everything that the insurance company tells us is indeed 100% correct. Let's take a look at another EOB right here. Now, what we can see here is this is from a commercial payer. We'll just run down really quickly. We do have our dates of service. This is September 1st, 2021. And we can see here, this is basically a kind of a facet injection that we have 3 different codes that are being performed: 64490, 64491, 64492. This again, it's called a service code here, but you know now to kind of think about, I know the procedure code or the CPT code is going to be somewhere on there. So I do recognize that. Here our quantity was just 1. And we do have what the practice charged, 1160, 580, and 582 for those 3 CPT codes collectively or respectively. Now, interestingly enough, this is interesting. And we see here that the allowed is somehow equal to the charged. Is that really the case? And we have to delve a little bit deeper into this remittance, and we start to see that something is going on, because all of these are zeros and the payment is 0 too. So what is going on? Our explanation of payment codes. Okay, this is going to give us a clue to more information here, and we can see the E95. It is telling us we need to submit clinical documentation because this service is not considered medical necessity. And then, as you can see, if it does process, it is going to be discounted based on this preferred contract. So this is a little disappointing because we have gotten no payment. And honestly, we really don't know what the allowed amount is because basically, when it's 100%, what that's signaling is, hey, you guys got to do this correctly because we're basically equaling that to the charge. We're not really paying you until you come back and submit clinical documentation, and then we'll let you know what that allowance will be. And remember here, just kind of a high level overview. We've got the tax ID. We've got the check amount. You can see, unfortunately for us, this is zero when it was the date. So these are all going to be kind of your high level information that you may need to know about the remittance. So I want to share one more with you just to kind of explain a little bit. And as you can see here, this is going to be a single service on 12/14/2021. Same kind of thing here where we've got well, this is a 73030. I just know that is indeed a radiology procedure. It's an x-ray. And then we have a new patient office visit. We've got the same thing going on here, though. I'm getting nervous. We've got a charge, and we've also got an allowed amount that's equal to the charge, and I'm seeing a lot of zeros. So as a biller, I got to figure out what's going wrong pretty quickly. And oh, there's my adjustment reason code. This is 27. Oh, yes, I can look here on my remittance and see expenses incurred after coverage terminated. So y'all know that just as well as me. Now what I've got to do is recognize that I got to go chase down that patient's registration information. Did anyone on my team verify that insurance eligibility at the point of service? Ooh, I may need to go ahead and call the patient to really be able to figure out what is going on. And so what we see here is the first remittance EOB that I shared with you, pretty clean. We were able to get paid. Got a little bit of trouble associated with that quality payment program that we would need to have looked at. And our next two EOBs were a little bit disconcerting. The first one that we saw that had a denial of payment was a medical necessity issue. And as a biller or a coder, I'm going to have to send in those op reports or notes. And then this third one, really got a problem associated with the registration associated with that. And what that means is I got to chase down some more information from that patient in order to get this claim paid. So, what I hope this has done is really helped you figure out how to look at an EOB. And I do want to mention one other term before we close our training today, and that indeed is the claim adjustment reason code. And there's also, that's called a SARC. And there's also a RARC that is going to be your remark code. And that is what I've been talking about with these little tiny 27s and the like. These are the codes that tell us what is going wrong with the non-payment. Now, what I'm excited to tell you is the insurance companies can't do that just all on their own. They actually have to use a code set from the Washington Publishing Company. This is something I would strongly recommend for you to have as a biller right up on your screen. And this is going to give you all of the different codes that the insurance companies will use. And again, you're going to see that the insurance companies use this same code set. So these are going to be your remark codes, remittance advice remark codes, and the Washington Publishing Company also do have the claim adjustment reason codes. And again, you can see these codes describe why a claim or a service line was paid differently than it was billed. So I'm just going to make sure that I have this on your training material so that you can go back and take a look at that. You can go back and take a look at that and really be able to find that information yourself. So I do hope this provided a helpful overview of reading an EOB, an EOP, or a remit. Good luck in your billing career. Take care.